As we hear more and more about tripledemics and quaddemics, people think this is scaremongering. What is it that we're talking about? Why is it coming on now? And what can you do about it? At the end of this, I hope you will understand the concept better. Two, I hope you will understand the science better. And three, I hope you'll understand why I'm giving you some very specific advice that's within your control. Listen to the end to get to an understanding of this. So, the first thing that we have to do is wonder what is going on in the news at the moment. And here you have this is in the BBC just from a couple of days ago. They are pushing the RSV, respiratory syncytial virus vaccine rollout to avoid a tripledemic. And this is where they're encouraging pregnant women, older people to get vaccinated against this tripledemic of RSV, flu, and COVID-19. So this is December 2024. And you may think this is new, but in reality, when you look carefully at what's been happening in the news, this is from Yale Medicine, and this is in 2023, January 2023. And what are they talking about there? A tripledemic, flu, RSV, and COVID-19 cases colliding. So this was already in there, and this was from 2022. So we're 2 years down the line, and this is still an issue. This is when they think about where you will have a surge of three things: flu cases, COVID-19 cases, and respiratory syncytial virus coexisting at the same time, sometimes in the same person. And what's what you call a viral co-infection. But it gets even worse than that because now they're talking about a quaddemic. So the NHS wants of a potential quaddemic of flu, norovirus, COVID, and RSV cases on the rise. And this at the moment, they are worried because there was a 350% increase in flu cases and 86% rise in norovirus cases. This is real. The big question is why? What is going on? Because think about it. Have you ever really heard about anything like this in the past? Where is this coming from? What is going on? They said in immunity debt in 2021, 2022. That means that, people weren't exposed. And so therefore, when they get exposed now, they then get an infection. That would work for 2022, but not 2023 and not 2024. So this is no longer just immunity debt. What is going on? And how common are these viral co-infections? And when I looked through, I went all the way back to 2012. And this was a paper on co-infections with influenza and respiratory viruses. And so they were looking at the fact that you can consider the presence of one or more viral agents in a respiratory infection. And they were suggesting that in complex cases, you order diagnostics for multiple viruses in specific patients. Now, you must understand that this was making reference not just generally to patients, but patients who were admitted into hospital and who were quite sick. And when they looked at these patients who had co-infections, they had specific characteristics. So you're looking at these patients. Patient one had Wenger's granuloma. So this is a condition, an autoimmune condition. Another patient had an autoimmune condition. Another patient had dermatomyositis with interstitial pneumonia, autoimmunity. Another patient had pulmonary alveolitis. This one had hemosiderosis. These were sick patients, even though they were of different ages. And what can happen is that if your immune system is suppressed, because all of them were on immunosuppressive therapy, either steroids or one other kind of immunosuppressive therapy, and all of them had severe symptoms in terms of their course. So, this in reality, when we think about it clinically, is not that common. What is going on? That's the question. So now you have to think and pull back and think, well, we just had a pandemic. Why would we now be having ongoing, not just COVID circulation, but triple, quadruple circulation of viruses? Here is a simple principle to think about when it comes to a viral infection. The body is quite sophisticated when it comes to its immune system response. And so, normally, if you get an infection with a virus, the first response is what we call an interferon response. An interferon is a signaling cytokine or protein, depending on how you'd like to describe it. And what it does is that when it's produced, it warns other cells that there is virus present. They shut down their protein making capabilities so that it is harder for a virus to infect them. Additionally, interferon warns the rest of the immune system there is a virus present, get on alert. And so, therefore, what can happen is that the whole immune system kicks into action. And critically, interferon, when it kicks into action, is also one of the major reasons you feel unwell. That's why you get a bit fatigued. That's why you feel a bit achy. That's when you feel unwell. The interferon has kicked in. Importantly, when interferon kicks in, largely it prevents infection not just with the virus that you are infected with, but any other virus. Let me repeat that. Normally, the interferon response shuts down the capability of any virus and some bacteria to be effective because it inhibits the mechanism that the viruses work. Nice and simple. Perfect system. So, if this system was working before the pandemic, what happened after the pandemic? Now, this is where you have to follow the thinking carefully and try and grasp what I'm saying. COVID 19, the virus, is exceptional at suppressing interferon. This is why so many people have no symptoms, even though they may be infected. It was quite fascinating early in the pandemic. You'd have a bunch of people just randomly being swabbed and they'd come back as COVID positive. They had no symptoms, and it's what you would call a subclinical infection. Because if you didn't have an interferon response, you wouldn't feel unwell. And if you didn't feel unwell, you wouldn't think of having any testing done. So the virus, and this is why people keep arguing about whether or not there's anything such as asymptomatic spread. Absolutely. I won't even bother to argue with people who say there isn't. Of course there is. This is why the virus spread across the world. It can spread without symptoms. That's because it suppresses the interferon response, so you don't feel unwell, even though you are infected. And that was the mechanism that caused severe disease. Because you didn't have that interferon response, what then happened early in the pandemic was the virus would get to the lungs, cause and trigger then a very strong interferon response that was delayed, and that's what caused the severe lung disease. That's the mechanism of severe COVID 19. It's all about interferon. So let's follow it along. Now we have a situation where, how do I say this? Just in case, I know I've got people who are looking out for every word I say and trying to find reasons to censor what I say. So let me try and say this as carefully as I can. Once there was the rollout, then you had a combination of two things because there seemed to be a level of interferon suppression that occurred after the jab. And actually, when I look more at the science, I think that that's part of the protection from severe COVID 19 because if it blocked the interferon response, which was absolutely critical for the severe COVID 19, what would then happen is that in reality, if you then had an infection, it would be harder for the immune system to get rid of the virus. Okay? That's part of the reason why I think we are seeing higher circulation of COVID in highly vaccinated regions. There seems to be a change in how the immune system is responding to the viral infection. And as I said, what has happened largely is that you have ended up in a situation where the immune system is struggling to be able to recognize the variants. And as my favorite image goes, what happens is that the original Wuhan variant looks like the lady in orange. She has orange hair and orange shirt. The immune system is so focused on the color of her hair and the color of her shirt, that's the spike protein focus, that if she changes her hair color and the top, the immune system doesn't recognize her, and therefore it doesn't do an interferon response. And that's largely what we're seeing at the moment across this population cohort. They're getting infected over and over again. People are continuing to spread the virus. And critically, now this is the bit that will help you to understand why this is occurring. If people are getting infected regularly, what then happens is that their interferon response generally is suppressed because this is what SARS-CoV-2 does all the time. It suppresses the interferon response. It does it in every cell it gets into. And if you have what I describe as a serum viremia, where the virus is now circulating in the bloodstream, infecting multiple cells, every cell it goes into, it shuts down the interferon response. And this is how you then have an issue with other viruses. So once you grasp that principle of interferon suppression at population level, suddenly it makes perfect sense. Any virus that can spread very easily, respiratory syncytial virus, influenza, norovirus. We better hope that we don't see measles as well, because you could see that that's the point. The immune system is no longer as responsive at a population level as it had been before. Really critical piece of the information. And this is therefore why we are seeing what appears to be first a tripledemic in 2022, now a quaddemic in 2024, and if this continues in 2025-26, it may be a pentademic. And if it continues, whatever number six is, it's that what it will become. So we have this very serious situation because this is going to make people very, very sick. As you can see, co-infections with multiple viruses can do significant damage to the body because they work in different ways, especially lung damage. The COVID virus spreads all through the body, so it does multiple organ damage. But then, if you have influenza and RSV on top of that, damaging the lungs, and then you have norovirus in somebody who is frail and who is struggling already, that's when you also see increased morbidity, where people get sick, and increased mortality. That's where we have people just never seeming to get beyond this infection. Really, really critical piece of the puzzle. And this anticipation, meaning that I had been working on this document now for a while. This anticipation is why I went about doing Disease X. Are you prepared? And you have to understand, Disease X is all about COVID and utilizing the science around COVID to help people get prepared. Join us. We're going to launch in a few days' time. Get a preview of it here. It's in a lovely story format, and you can sign up for your email here. Our aim is to get this to be number one because so many people need to read this. Everybody needs to understand what is the science as to what's going on, and critically, what can you do about it? Okay? So this is part of the issue. Now, as I said, I can see the comments, and somebody says this is just fear mongering. I didn't make it up. And as I said, I will show you as well. This is literally what is in the news. NHS warns of potential quademic. You can see here, this is a BBC tripledemic. This is just there. It's not made up. Now you can ignore it, and that's part of the problem. Now, some people will say, I don't care, let it come. That's fine. That's a choice. That's your decision. I'm saying recognize that there are risks and try and see if there are ways to mitigate it. So, what I'm going to give you here is one very simple strategy that literally every single person in a temperate climate, especially if you're in a tropical climate, maybe a little bit different depending on your lifestyle, but in a temperate climate, you absolutely need to make sure your vitamin D levels are adequate. I repeat, you have to make sure your vitamin D levels are adequate. Now, I'm going to be showing a paper with regards to this was a preprint. I can't understand why this is still a preprint because it was published since 2022 in the BMJ, looking at vitamin D supplements for the prevention of COVID-19 and other acute respiratory infections. And just remember at the end of this, they're going to say something here that you need to know. On their conclusion, they didn't find among adults with a high baseline prevalence of suboptimal vitamin D status, implementation of population level test and treat approach to vitamin D replacement did not reduce risk of all cause acute respiratory tract infections or COVID-19. This was their conclusion. And you may think to yourself, well, if that's the conclusion, why are you talking about vitamin D? And it's because if you understand what vitamin D does and how it works, and the fact that it's not necessarily just about whether or not you've gotten an infection, it's about how it works, one, with interferon, because it helps to boost the interferon response. And two, it has an impact on the way how specifically COVID operates. And what I'll show you here is I'll show you just one slide from a really important paper that I've shown on many occasions, but it is so critical for you to understand how this works is that we have here this slide, which was taken from the replication of SARS-CoV-2 in airway epithelia. So they had infected cells and then observed what happened. And in this, it shows you just how fast the virus operates. This here is air. Where you see cream is mucus. Normally, the virus can't get to infect the cell because there's a mucus layer there. And so what it does, it binds to the cilia that are normally sweeping the mucus. It slides down. Once it gets down to here, it then infects the cell. The problem is it can't get out of the cell because it still has to then get through the mucus layer. But if you notice very carefully, it has microvilli here. And these microvilli normally help with absorption and interaction with the surface of the airway. It then interferes with two proteins, PAC1 and PAC4, which cause these microvilli to no longer stay like bush to become like trees. And so these microvilli then start growing within 24 hours, and by 48 hours, it has the exit route. Now it can get above the mucus and just spread avidly. And then it does this over and over again. The point is that vitamin D, along with something that rhymes with pectin, interfere with this process. It doesn't stop it, slows it down. And so, therefore, it gives your immune system time to respond. Simple strategies with regards to how to interfere with the viral infection. Because the point is, at the moment, what it seems is that the primary infection that needs to be controlled is SARS-CoV-2. Because if you can control SARS-CoV-2, the interferon response will then impact on any other virus, whether it's norovirus, whether it's influenza, whether or not it's RSV. If you have ongoing circulation of SARS-CoV-2, you then have an issue with regards to what happens with regards to infections. Now, people may say, well, I take a little bit of vitamin D, or I'm not worried about vitamin D, or I don't know how much vitamin D to take. And this is why I said I'm just concentrating on this one simple strategy that I think should have been implemented at population level. I cannot understand why this was not done, even in COVID. Even if, I tell you, even if a scientific person says, listen, there is no evidence that vitamin D helps with COVID. My point is simple. If you are vitamin D deficient, you are more at risk for multiple other diseases. Everybody needs to not be vitamin D deficient. It's actually irrelevant whether or not you argue about if it helps in COVID. I'm just telling you the science tells it does. But even if it didn't, you've got to get it into an adequate range. So here is what it looks like from the same study of about 6,000 people where they didn't find benefit. Now look at this here and try and understand what was going on. It's a bit hazy, so you'll have to trust the numbers that I'm telling you. On the left here, it's the vitamin D concentration from 0 to 50 to 100 to 150 to 200 to 250. It's the same on this chart here. Going across the bottom here, what you need to focus on is the baseline. This is 6,000 people in the UK they checked. The depending on where you are, the cutoff is at about 50. But in truth, they found that they had to reduce this number. It used to be 75, but so many people were vitamin D with deficient that they dropped it down to 50. Even at 50, across the population, we're talking about almost 86% of people were below 75. And here you can see easily probably 60% of people are below adequate levels. Okay. And this is just to prevent deficiency. So across the board, everybody is deficient. Now, I'm going to show you something about it afterwards. So the first point is that if I was to gamble with 100 people, maybe only 10 to 15 would be in normal range. The rest of you would be vitamin D deficient. And depending on what level you chose would determine how many of you were vitamin D deficient. Now, think about something. What they are measuring with vitamin D deficiency is the level to prevent disease. Okay? The level to prevent disease. Now I'm going to show you again the chart and think about this. If you look to the top here, 250, depending on where you are and depending on what the measurements are, in many places that top level is 400. You actually, when you think about it, because this is the deficient level, so even after they gave them vitamin D, they were all primarily less than 100, except if they had 3,000 units per day, higher dose than the 800. I would think that just being practical, you would want to be between 150 to 200, or maybe even a little bit higher, depending on your comorbidities. When you look here, the fraction that were above 200 was minimal. And so people don't actually have to worry about have to take, they can take too much vitamin D. They can, but I can't tell you the story that I have seen, but I have seen somebody take, let me work out the numbers, 50,000 units for 2.5 months daily. And it took 2.5 months before he went in the toxic range and became hypercalcemic. So we're talking about millions of units of vitamin D. So the principle is that, so to put it this way, if you were vitamin D deficient and you were, say, less than 30, and we were loading you with vitamin D, we are using about 300 to 350,000 units over 6 weeks to try and get your levels into the normal range. And so this is why I'm saying to people, just be practical and actually don't guess it, get it measured. Just ask your doctor. And if your doctor doesn't want to do it, just find there are so many places that will do a vitamin D level for you, either finger prick or otherwise. There literally is no excuse not to know your vitamin D levels. And the point that I'm making is that just at even a population level, you tell everybody you know to check their vitamin D, friends, families, colleagues, and just tell them that. If everybody did this and made sure that everyone's vitamin D levels were optimal, not just above the deficiency range, but in an optimal level, say about 150 to 200, I suspect that we would wipe out the circulation of most viral and some bacterial infections because the immune system would respond so well just to that simple strategy. So that's why I said when we think about this point of this quademic as it's coming up at the moment, and that's flu, norovirus, COVID, RSV, the simplest way to manage this is to improve interferon responses. And the simplest way to improve interferon responses is to use vitamin D. Vitamin C is something that you use in an acute infection. Vitamin D has so many benefits. It's a whole discussion on its own. As I said, everybody has that responsibility. Please just check your levels. And then after 3 to 6 months of taking good doses, check it again. You don't need to guess it. Make sure this winter, especially in temperate countries, also in tropical countries where people are wearing long sleeve clothes or they're in offices all the time with air conditioning, they can also get vitamin D deficient. Please, this is so simple and so achievable that you shouldn't need anyone to tell you to do it. This is of benefit to you, whatever and wherever you are. Final point, remember, support us in this journey. Are you prepared against disease X? These are the things that we're covering, explaining why disease X, if you implement all the strategies for COVID, you are unlikely to find a virus that is going to evade all of these things. Join us in the journey. If you don't believe how good it will be, click on the preview. You don't have to register. If you're interested, sign up below. The launch date is coming up quite soon. We want you to support us. And please stay safe, stay well this winter. Don't end up in hospital just because you didn't do the simple things right. Have a great evening.